I would tell people, let's look at what's in our hospitals. Let's look at our hospital situation because we know that those are real numbers and we know right now that they're still full.
That was San Joaquin County Health Officer Dr. Maggie Park explaining where people need to look right now for an accurate insight to local coronavirus trends. This was echoed by EMS spokesperson Marissa Mata, who also emphasized they still want people to call if things take a turn for the worst.
Over the past week, it's been pretty consistent. About 50 to 60% of our ICU beds have been occupied by COVID positive patients. Call 911 if you're having a serious medical emergency, shortness of breath, heart attack, stroke, things like that. Yes, our hospitals are very busy, but that system is still in place for people to be using.
This is all because, as we told you yesterday, there's a glitch in the state's reporting system, and it means new case numbers across most counties in our region are not correct. So today we're looking at hospitalizations in ICUs since the beginning of June, and this is San Joaquin County. As you can see, hospitalizations have risen sharply since the beginning of June and are hovering at about 200 people a day right now. ICU admissions crossed the 50 mark in mid-July and haven't dropped below since. And it's also a similar situation in Stanislaus County. They started with just 22 hospitalizations and 7 people in ICU at the beginning of June, and now Stanislaus consistently has 10 times that number of people in the hospital and has continued to hover around 50 people in ICUs due to COVID. And finally, Sacramento County. The incorrect numbers rather, being reported by the state show that cases are dropping, but these numbers give no indication of such a thing. Sacramento County now consistently has over 250 people a day in the hospital, and ICU admissions are creeping ever closer to 100. And Chris, this is clearly not the numbers that we want to be seeing.